Healthcare workers have been some of the real heroes of the COVID-19 pandemic, but some folks on the front lines of the fight to end the pandemic are in short supply right now. Newswatch 12's Lily Zoller joins us now live in studio with more. Lily.
Thanks, Justin. The American Association of Colleges of Nursing reports that the number of nurses that have left the workforce has doubled in the last 10 years in comparison to previous statistics. This is all the while we need nurses now more than ever.
Nurses are the key to healthcare. They're here 24/7. They're here yesterday, they're here today, and they'll be here tomorrow.
While they may be reliable, healthcare officials say there just aren't enough experienced nurses to meet healthcare needs right now. Hospitals around the U.S., including Aspirus here in the Northwoods, are experiencing what many are referring to as the 2021 American nursing shortage.
I think overall, years and years, we've been coming up with a nursing shortage, and I think COVID has just accelerated it because of the patient volumes and the intensity of the patients.
The virus has also altered the type of nurse that's in the highest demand right now.
Our greatest need is in the inpatient hospital setting, in the critical care areas.
Nurses with that type of experience are also the hardest to come by because of the aging population and increasingly complicated patient needs. Hospitals like Aspirus are having to get creative to cope with this.
Particularly in the Northwoods, there's a lot of cross-training. And I would say much of the success to the nursing staffing is because we have a very flexible workforce.
In addition to flexibility, hospital administrators are heavily relying on their contingency staff, and recruiters are casting a wider net now than ever before.
We are cross-country. Alaska, California, Texas, Florida, absolutely. So we're all over looking for that experienced nurse.
The good news is that Aspirus has been successful in their efforts. In addition to the introduction of signing bonuses and other successful incentives to recruit new nurses, Aspirus administration say they've been more efficient to best utilize the resources that they do have.
I would say that the outlook for nursing is one that the care models are going to be changing. And so the outlook will be is that in order to survive into the future, we're going to have a really flexible workforce.
While it may be tough, Aspirus reports that they hire an average of 1 external nurse per day. But the need for nurses within the Northwoods and around the country isn't expected to let up anytime soon. Justin?